Hospital-acquired infections are thankfully now on the decline. Certainly 5 to 10 years ago they were in all the newspapers.
It is inevitably the case when injured and ill people come together that the risk of infection is always constant.
The two most common hospital-acquired infections that we often carry out medical negligence investigations into are MRSA and C. difficile.
MRSA is an infection that is usually on your skin.
People become particularly susceptible to developing such infections if they do have open wounds.
If you get any infection in the wound, and it doesn't have to be MRSA, it can be any infection in a wound and it's not treated, it will not only prolong the healing time, it can result in very poor healing.
So it's therefore important that appropriate dressings and steps are taken to ensure that those sorts of risks are minimised.
It can also happen as a result of failures in cleanliness in a hospital.
In extreme cases that can involve closing wards and closing rooms.
It's vital that staff maintain a good standard of hygiene.
Those procedures and protocols must be in place and they must be followed, because the consequences of infection can be very severe indeed for those who are in hospital and particularly vulnerable to such infections.
If somebody does contract a hospital-acquired infection, it can lead to them having a prolonged hospital admission, which in turn can lead to a prolonged recovery period.
Hospital-acquired infections are devastating to most patients because not only have they had to have an operation, but if they develop an infection, be it MRSA or C. difficile, that situation is made a whole lot worse.
To bring a claim in clinical negligence, it's important firstly to consult a specialist lawyer who deals with only clinical negligence claims.
If anybody thinks that they have either contracted such an infection or they know a family member or anyone that has, then I would certainly recommend that that person contact us so that at least we can discuss it with them.